Mary Mogle is with us. Now, we have Laura Jeffrey scheduled just after 8 o'clock this morning to talk about the stroke program, but we're so happy that you stopped by because you are very much involved in this as well. Stroke, Are You at Risk? Is a program coming up on Thursday at the 4th Floor Family Waiting Room at IRMC. It's at 6 o'clock, and folks, I'm going to give you a phone number right now that you can call. It's 357-7188 to register for this absolutely free event. So, Mary, let's explain your role in all of this and your role in the stroke program at IRMC, which is, after all, a certified primary stroke center.
Yes, it is. My role currently is the clinical coordinator in the emergency department. As of November, when our current stroke coordinator retires, I get the privilege of being the stroke coordinator for IRMC, which, as you said, is a primary stroke center.
Yeah. So you helped to set this program up, obviously.
I did.
Yeah.
Yes. There was a number of people that were involved, and we've been a stroke center since July of 2014. Have some great members of our team, the neurologists that we work with, Dr. Nowak, Dr. Turoff, and Dr. Ianazzi, as well as Dr. Balewick, who will be speaking at this program, is our medical director in the emergency department, along with people from Citizens Ambulance Service, as well as the American Heart, American Stroke Association.
Yeah, and there are going to be some free health screenings available as well.
Yes, there are. We'll be doing some blood pressure checks and some heart rhythm checks as well.
All right, so folks might not consider themselves to be at risk of a stroke because maybe they don't have a family history of it, maybe they don't have a personal history of anything that would indicate that. But that can be a surprisingly deceptive point of view, can't it?
Right. There are risk factors that you can't modify, such as your age, your gender, and things like having a history of a stroke. But there are a lot of other risk factors that people need to watch, things like their blood pressure, if they're diabetic, to take care of their blood sugars. You need to monitor that. You need to be physically active. Maintain your weight, things like taking medications that your doctor prescribes to treat those conditions are all very important.
And while you may not be able to prevent a stroke, you can certainly minimize your risks.
Yes, you can minimize your risks by monitoring those controllable risk factors.
And that's really the primary way to approach the risk of a stroke.
Correct.
However, if you suspect that you might have had a stroke or may be in the midst of it, there are things that you need to do, and you need to do them now.
Yes, it's very, very important that you get help immediately. Once you start having the signs and symptoms of a stroke, which can be things like a sudden weakness in your arms, legs, or face, especially if it's on one side of your body, sudden confusion, trouble speaking or understanding what people are saying, trouble seeing out of both your eyes or even just one eye, a sudden onset of a severe headache with no known cause, or trouble walking. All of a sudden you have difficulty walking, you have dizziness, things like that. If any of that happens, you need to get to the hospital right away. There's a short window, about 3 hours, in which if you have a blood clot in your brain, called an ischemic stroke, that we can give you medications to help break up that clot. But that 3 hours is very important that you get help in that time frame.
Yeah, and as we're talking about stroke, there are two primary types of stroke, correct?
Correct. There is the ischemic, which is the blockage kind, and then there's a hemorrhagic, which is bleeding in the brain. And getting help for those is equally as important. There are other therapies that at comprehensive stroke centers can be done to take care of that. But again, the sooner you get help, the better your results are.
And when somebody has one of those symptoms that you just mentioned, quite often they're temporary, they go away. And you're tempted to say, well, it was nothing, something happened, but nothing really important because I feel fine now.
Right. That's called a transient ischemic attack, or a TIA. People used to call them mini strokes. And if you have one of those, you're at much greater risk of having a full-blown stroke or CVA. So it's important that you get seen for that and treated and follow up to prevent a bigger stroke from happening.
And Dr. Balewick and others will be talking about this on Thursday.
Yes, they will.
It is again at 6 o'clock in the 4th floor waiting room, the family waiting room at IRMC. And that's not a huge room, but it's big enough to handle a good deal of people.
Yes, it's big enough, I think, for what we want to do.
357-7188 is the number to call to make sure you register for this. It's absolutely free to you. Now let's talk a little bit about a certified primary stroke center. What does that mean?
In order to be a primary stroke center, you have to be accredited by a body, and we recently had our recertification and passed. CIHQ is the company. People are familiar with JACO maybe, and it's a similar type of agency. They look at the different processes that we have and a lot of the previous data that we collected on the patients that we've taken care of. And in order to be the primary stroke center, there are certain things we have to be able to do, having CAT scans read and done in a timely fashion, seen by physicians, having follow-up care as needed. The agency will certify you for 2 years. Actually, I think it's 3, I'm sorry. And when an ambulance gets a call for someone with stroke-like symptoms, they're to take them to a primary stroke center. So thankfully for Indiana County, we're close.
Yeah.
And they don't have to travel to a hospital that's further away, which again is time. Time is brain tissue, and again, the sooner you get help, the sooner they can treat you.
Yeah, and with that designation as a primary stroke care center, it means you've got specifically trained people who are trained to handle that. When they see you coming in the door, they know exactly how to spring into action.
That is correct. We, in the emergency department, if we have someone that comes in with stroke-like symptoms, we call what's called a stroke alert. And that notifies a lot of people. It notifies our CT department. They make sure there's a CAT scan available for us to use immediately. It notifies the neurologists so that they're on standby should we need to have them come in and administer that clot-busting drug. All the staff in the emergency department has undergone extensive training in recognizing strokes and what we're supposed to do. So all of that kind of plays together so we can get people what they need as quickly as possible.
And when someone has a stroke, obviously you get through the crisis of the moment in whatever way you best can. The recovery process then begins, and sometimes somebody has the stroke, they're treated, they don't really betray any signs of having had the stroke. There obviously are some within their body that are happening, but they're able to get along with without anybody really knowing. Others, it's not nearly as easy, is it?
No, some people are very fortunate that their disability is not as great. It's great to them. But there are people that do need to have further care. We sometimes send people to a comprehensive stroke center where they're treated. We also have the rehab unit at the hospital, so if somebody needs to have rehabilitation, we like to have them come back home to have that done, and they do a great job up there as well. If the stroke doesn't require a comprehensive center, they're admitted to either our ICU or our telemetry unit, where those nurses are also specially trained to take care of stroke patients and have physical therapy, occupational speech therapy, whatever they need, dietary as necessary.
Yeah, Mary Mogle was our guest this morning. Now you're going to step up to the coordinator's position in November. What does that mean? What does that entail for you?
It's a lot more of more of the data collection. There's abstractors that actually do that, but you have to look at that program to see what are the areas that we could improve our ability to take care of this type of patient, staying on top of what the newest guidelines are, networking with other stroke coordinators to see what kinds of successes they've had in treating this group of patients.
In the medical industry overall, the advances that come by in the course of, take any time period you want, 6 months, a year, 2 or 3 years, they are rapid. I mean, they are fast. New things come along, treatments, medications, whatever it happens to be, technologies, and boom, all of a sudden people's lives are 50%, 100%, 200% better. With stroke, how often or how rapid do the changes come in the protocols, in the medications, in the equipment and technology? Is it as quick as that?
Some of that all depends on the research that's done. They update the guidelines yearly, and sometimes there's not a lot of changes. They've decreased the recommended time from the patient coming into the door of the emergency room till the time you get any kind of clot-busting drug, as well as the time for the CAT scan, which again emphasizes that need for doing things as quickly as we possibly can in order to preserve brain tissue.
Yeah. Probably a good slogan is not stroke, you can fix it. You could probably come up with something better than that. Mary, thank you so much for coming in this morning. We do so appreciate it. The program is called Stroke, Are You at Risk? It's this Thursday, 6 p.m., the 4th floor family waiting room at IRMC. And again, I want to emphasize that number, 724-357-7188. It's absolutely free. They want to know that you're coming, though, so give them a call and get registered for this program. It sounds like it's really going to be not only fascinating, but it could save some lives, too.
Yes, it could.
We appreciate you coming in. Thank you so much.
All right, thank you.
It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM.